Seems we're live, and we are talking to adults with SMA. This is about what happens when you become an adult. Now, from a physiotherapy point of view and from a body point of view, you become an adult when your bones all fuse and you stop growing, because that's when a lot of the changes stop happening. That doesn't mean you can't get worse, you can't get weaker, you can't get more contracted. But the major changes in your body will stop when you stop growing. And that's later than you think, because while you may not grow taller, you can still grow your bones. And some of the people who've had spinal surgery will know that even if your spine stops growing, your ribs can still grow and you can twist, and you can still have longer arms, longer legs, bigger hands. Things do change until boys are about anywhere between 17 and 19, and girls are anywhere between 15 and 17. So you may not be growing taller, but your bones don't fuse completely until then. So one of the problems that we have with adults is when you leave school, suddenly everything stops. And no matter how motivated you might have been as a child, as a teenager, it's very, very hard to stay motivated about exercise when you can do very little for yourself, when the facilities aren't there, when it's difficult. I mean, swimming is a wonderful exercise, but there is nothing worse than having to get to a pool, the awfulness of getting changed, getting in the water, and then for half an hour you have taken 2.5 hours to get there, get changed, get in, you get a nice half hour in the water, and then you've got to do it all again, get dried, go out and get home. So exercise is not easy when you have physical limitations. But what we need to think about in the context of individuals and nusinersen or any of the other drugs that are currently being developed is, what do I want from this drug? What can I effectively do? What can I do to keep myself fit if I want? And how hard is that going to be? And let's get real, we are not talking easy. This is a bit like the difference between lockdown and out of lockdown. Lockdown was easy compared to the chaos and confusion that's happening now. And it's the same with exercise. Childhood was easy compared to the chaos and confusion that becomes an adult in terms of physiotherapy, in terms of exercise. And there's a brand new resource for neuromuscular patients. It's aimed at adults. It's about Pilates. It's 4 individual videos. They're free. They're on YouTube. And you can go and look at these. They're standing, sitting, prone, and lying. And the vast majority of adults I know with SMA would not be able to do most of it. And that's a little disappointing, because I, as a Pilates fanatic, do believe that Pilates has a place. But one of the problems with a resource like this is when it's for neuromuscular, it's covering everything from adults with Charcot-Marie-Tooth who can be walking around with relatively little difficulty, to some of the SMA and other myopathy adults who actually are severely limited, and some of the more progressive disorders like the dystrophies, which are continuously getting worse. So that that sort of video has to be very general, and so isn't very specific to people with SMA. Now, we have to understand that as adults, generally you are a very mixed group. There are those of you who are still walking around, who are still relatively functional, can manage most things, maybe not stairs, maybe not running, maybe not a lot of sport, but you are still independently ambulant, whereas most of you will be mostly full-time wheelchair users. And again, depending on whether you are a type 2 who was actually always a weak type 2, always had difficulty using your arms, or whether you are a non-ambulant 3 who has much stronger upper limbs, again, your function will be very different, and the things that you can do will be very different. Now, we know there is madness in the NICE agreement that somebody with type 2 who never walked and is non-ambulant in a wheelchair is getting nusinersen, whereas a type 3 who may have lost ambulation 20 years ago, who for all outward appearances seems identical to many of the type 2s, will not get nusinersen because they did walk. And there is no realistic reason for that to happen. But those of you who are non-ambulant type 3s, you really need to be the ones that are focusing on this, because while you are not getting the drugs, you could be building up some power to make the drugs that will come more effective. And what I want to do is look at adult physiotherapy, and that's what we're talking about, in 3 basic areas: exercise, joint range, and pain. And I would say that those 3 are probably the major areas that we need to discuss. There will be other things. A lot of things will be in the realm of OT. So it may be that an OT service is where you need to be directed. If it's wheelchairs, then it's wheelchair services. Very often, all you need from a physiotherapist when it comes to wheelchair is a letter saying you need this, 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 and this. But we all know that many, many things are difficult, and somewhere near the top of the pile are wheelchair services. So where I am going to start with is joint range, because a lot of things, actually no, I'll go back. The first thing we're going to start with is exercise. And one of the reasons that all of you, even if you are an adult type 1, and I know there are adult type 1s out there, there is nothing to say you cannot exercise. And the biggest problem we have is that while you do not move in, you know, you can't move your arms, you can't move your legs, you seem very limited. There are many, many things you can do that are still exercise. And one of the things I've talked about to parents of children, and it's exactly the same for adults, is what we call static exercise. Static exercise means your muscles are contracting even though they are not moving. And there are many times you can think about that happening. So that if you look at someone, if you're particularly weak and you don't do these activities, if you look at someone who is opening a very tight jar or bottle and they'll screw their face up. Now, it's not their face that's actually opening the jar, but yet their face is going, and they may even curl their toes up, and all sorts of muscles are going when they're trying to open that jar. And so that you are getting what we call overflow into other muscles just by trying to work hard. And the other example of exercise that you can do is static exercise. So overflow works. I know very often when we ask the children to pull their foot up, their hands working like mad. And you probably can do that yourself. If you really, really work hard to try and pull your foot up, whether it moves or not, if you sit here now this minute and really, really think about trying to pull your toes up, trying to pull your foot up, you will find other muscles working. You'll find your face starting to screw up. Some of you will find your hands coming up. And that is overflow. And all the muscles that work want to help. And the other form of static muscle work is, imagine you are trying to push a broken down bus. Now, irrelevant, some of the strongest people on earth could not push a broken down bus. But you imagine the effort that you would still put into it. And this is static muscle work. And this is where we start. So nobody out there listening, no adult with SMA can do nothing. You can twitch. That is the basic amount of muscle power. Now it's possible, and we've seen it, we know it's happened, that it is so long since you've used your muscles that actually you no longer know how to switch them on. You literally can no longer feel them. The connection between brain and muscle seems to be completely interrupted. And as much as you think about trying to kick your leg, not saying movement, think about trying to do it. Think about trying to lift your arm out to the side, trying to switch on your tummy muscle. It just seems like it's not happening. There's nothing there. And there are ways of switching on your muscles. So let's start right at basics, muscle twitch. If we were to say that we're trying to counter all the contractures, all the strong movements, all those muscles that we know work better, we want to switch on the opposite muscles. How do we do it? So that we know that this muscle here is a very strong muscle that pulls your hand up and turns it over. This is brachioradialis. Everybody thinks biceps is strong. It's not. It's this muscle across the top of the arm. This one here, brachioradialis. It bends and it twists. It bends and twists, and this is why we often get stuck in that hand twist position. And the muscle that counters that is still triceps. How do we switch triceps on? Now we can switch triceps on just by trying to push against something. It can be push against the tray, the table, the arm of the wheelchair, anything. You can try and switch this muscle on. So there are ways of doing it. Just literally trying to push that hand away. Push against someone. Do what we used to always say, backwards arm wrestling will start firing up this muscle. So these are the sort of thing. We want this muscle fired up. We want to start doing it because that muscle also helps with moving outwards, because triceps attaches here. So that if you switch it on here to straighten your elbow, you're also helping to pull your arm back. And actually there is, you can just feel it when you move your arm back under there. And that's also triceps. So there's plenty of things we can do. Much harder to turn our hand over, but if you think about it, if you put your hand there and you want to roll it, switching on the muscles that turn the hand the opposite way rather than pulling it forward. So these are the muscles underneath that turn, and there's a big muscle that comes across your wrist that turns it. Same in your legs and your tummy muscles. You just think about trying to hold your tummy muscles. Now, many of you will have had spinal surgery. If the spinal surgery has gone all the way into your pelvis, there is very little you can do in terms of movement. But you can still use the muscles. You can still use your tummy muscles. We know in SMA they are exceptionally weak. And a lot of you will breathe using your diaphragm, but your muscles are still there and you can still switch them on. So there are things that we can do, moving our arms out to the side, moving our shoulder forward by trying to push along your tray, push sideways along a table, swinging outwards is a good movement. But if you really cannot switch your muscles on, there are a few ways that you can do it. One quite successful but not very popular way is ice. Now, those of you who've ever had anybody put ice cubes down your back or ice cubes worse down your front, you tense up. Your muscles will go into tension if you put ice on them. That cold, that desire to pull away, the desire to get away from that stimulus, the shock will make your muscles twitch. And you can switch muscles on by putting ice on them. Now, I don't mean a blob of ice. I don't mean an ice pack. This is not the same thing. This is not actually cooling your muscles. It's stimulating them. It's quite different. And it's brushing the muscle with an ice cube or something cold. It could be an ice lolly. I don't care what it is. That's up to you. But ice does stimulate muscle. Now, again, you are going to often have to find people to help you do this. But ice will stimulate muscle. There is FES, functional electrical stimulation, which can help to fire up muscle. It means putting an electrical pad, you have a little box, you switch it on, and then you start twitching. Now, some people don't like it. I personally find it quite, but if you're really looking to switch on some muscles, you can do it with functional electrical stimulation. You will need a physiotherapist who knows what they're doing. You can buy these things on the internet, but ideally you will find a physio who knows what they're doing, because if you buy them on the internet, 9 times out of 10, the instructions that they will give you will be for the wrong muscle groups. And this is what's important. It's not a case of just plonking it on and switching it on. You need to know what you're trying to achieve, which muscles you want to start working, what is important, what is going to help, and how you can build that into a program, because it's not just about switching them on, it's about keeping them on and then getting them stronger. And the third way that you can switch muscles on is with taping. We've talked about taping before. There is another webinar on taping, and taping can switch on muscle. It doesn't work for everybody, but then not everything works for everybody. But taping can switch on muscle. It can actually help to get a contraction out of muscle. So once we have switched the muscle on, whichever way we do it, with work, active work, with ice, with electrical stimulation, with taping, so that's actually 4 ways because they may just work themselves, then we need to actually try and build on that. So once we have a twitch, once we have a flicker, those are the basic contractions of muscle, then we want to build on it and make it stronger. Any questions so far, Marnie?
Yeah, we've got a few.
Okay, do we want to take a few questions at that point?
Yeah, so we've got a few from Connor, and I think you've mentioned this slightly, but I'll just mention it again, so go over it. It says, my left wrist is bent over and will not straighten. Can I fix this?
Okay, well, we're going to talk about contractures as opposed to contractions, which is muscle work. We're going to talk about contractures when we finish with exercise. Mostly in adults, you cannot correct contractures fully. You may be able to stretch them a little. Some will be easier to stretch than others. There are ways of helping. There are ways of making sure they don't get worse. But generally, once you get to be an adult, once you have stopped growing, knees, hips, and elbows tend to stay the same. It's very, very hard to stretch them. It's not impossible, but it's hard. But we will talk about that when we come to stretches and joint range.
Okay. Again, from Connor is, have you got any hand exercises that would help strengthen fingers?
Yeah, there's quite a lot you can do with hands, and that's actually some really nice things. And I think lockdown might have shown a few people that baking's a good hand exercise. You know, I can give loads and loads of hand exercises. On the other hand, we can think about what activities we can do. One of the big problems that we have these days is everything is based around something like this, where all you're doing is this, which is a lot of thumb and not a lot else, or a lot of poking and pointing, as you would do on an iPad, or a bit of this for turning pages of a book. To be honest, you need to get in the kitchen, get in the shed, get in the garage, get the messy bucket out, go and find some kids with a big craft box. You can bake. If you really want to do a brilliant hand exercise, start making bread, start making pastry, go and watch Great British Bake Off and see what you can get up to with your hands. Go and make bread. Go and make rolls, go and make pastry, because that's one of a brilliant hand exercise. And the beauty of it is you have something to eat at the end of it. So one of the things that I find so boring about exercise, it's great when you're doing it and it's great when it's done, but when you finish, that's half an hour and you've got nothing for it. And if you go out and bake, go and get some needles out, go and get some knitting needles out and get the wool out, go and crochet, go and sew some buttons on, go and do some mending. Oh my God, who does mending these days? Just throw it out and get back to Primark when it's open now. But you know, there is a lot of things you can do with your hands that is a little bit more interesting than just doing exercise. Get the vegetable peeler out, get a good vegetable peeler, go and peel some potatoes. You know, there are so many things you can think of. And the other piece of equipment that is such an easy piece of equipment for hands and fingers is the humble elastic band. And you can put an elastic band around your thumb and you can be doing this, which is quite a nice one. You can put them around your fingers this way so that you can be doing that, or you can put it around all your fingers and be doing that. You can pull, you can have an elastic band pinned to something and you're pulling up. So actually an elastic band is quite a nice piece of equipment. There are things where you want to be wringing, pulling, so get a wet flannel and squeeze it out, get sponges and squeeze them out, twist them. It's a lovely one is twisting backwards, particularly twisting outwards this way. Get the craft box out and get the screwdriver out, get some screws sorted. So there is lots and lots of things you could think of you could be doing with your hands. Yes, you can have exercise programs. As I say, an elastic band is a very, very effective piece of exercise equipment for hands. But so is therapy, so is Play-Doh, so is quite a lot of stuff. Even Lego, for some people, is hard work. Duplo, if you can't manage Lego, go and get the Duplo out because it's great for your arms as well. Even better if you've got children or friends' children. I know we're in lockdown, but have competitions with them on Zoom or on FaceTime and so you can build the fastest tower. All these things you can be doing with your hands. No end. Get a pair of scissors out. Go and do some cutting out. Go and make some dancing dollies. Whatever.
Okay, great. We've got quite a few questions, so just let me know.
Yeah, no, let's just go, and then if we're going too long, I'll get on to some more work on exercise in a minute, more specific.
Okay, so we've got another question is, how do we get the level of NHS physio involved needed to make any new treatment successful when most of us have been forgotten about?
This is really, really difficult, and I absolutely agree. The biggest problem we have is this, you get to 17, 18, 19 or 16 these days, and everything just stops. To engage in NHS physio, normally for most adults with SMA, it's an acute situation. You've either got a chest infection or a pain, broken something. It's very, very difficult to actually get a physio. And the only way I can suggest that you will get any NHS physio involved around the time of treatment would be via your neuromuscular service. So you need to ask your neuromuscular consultant or your neuromuscular physiotherapist when you go to see the neuromuscular consultant to contact the local team and ask for, refer you for physiotherapy, for exercise. It may be that some NHS practices now do groups. Some GPs can actually refer you to a gym. So there are different things that happen in different areas. And again, we have to remember that what happens in England is not what happens in Scotland, Wales, and Northern Ireland. And you will get different with a different GP area. I live in one area of London, my GP is in a different area. It's very, very dependent sometimes on the borough you live in or where your GP is or who's holding the purse strings. But the best help you can get in terms of being referred for NHS physiotherapy, and you may sit on a waiting list for a while, is your neuromuscular consultant. It's very difficult. I accept there is no justification in having physio regularly until the age of 16 and then whoosh, suddenly it stops. But you know, the SMA is no different from any other lifelong condition, apart from the respiratory conditions like cystic fibrosis, where you will continue management into adulthood. But many, many of the childhood conditions, cerebral palsy, osteogenesis, so many conditions that you will stop getting physio. This is not unique to neuromuscular conditions, unfortunately. And I don't think it's going to get better post-lockdown, because I do think the government ultimately, and this is a little bit political, will be finding ways to make up all the money that this problem has cost the economy. So I think we're going to find it harder, not easier.
Okay, and linking to that question, we've had another one. That is it a specific website or company that have a list of private physiotherapists that would understand SMA if we were willing to pay?
Yes, yes. Now, there's two ways of doing this. Again, through contacts, because the best people normally who will know somebody with neuromuscular experience is your neuromuscular service. And the other place that you can go to ask for help is the Chartered Society of Physiotherapy. That's the CSP website. And they hold a list of private physiotherapists and their specialities. Now, unfortunately, the vast majority of private physiotherapists are what we call MSK, musculoskeletal, sports injuries, back pain, neck pain, whiplash injuries, all this sort of thing. The most common private physios are MSK. You need a neurology physiotherapist to work with you if you have a neuromuscular problem. So it's a neurology physiotherapist. Now there's another group called ACPIN. You can't get access to that directly, but you can indirectly. ACPIN, ACPIN, and that's the physiotherapists in neurology, and you can ask for that. They are part of the Physiotherapy Society, and you can find physiotherapists who do have experience of neuromuscular disorders. Unfortunately, like so many things, neuromuscular disorders are relatively rare. SMA in the adult population, if you are treating adults with neurological problems, the majority are stroke, multiple sclerosis, brain tumors, and other issues. SMA is still a very, very small part of anyone's caseload. So to actually have a lot of experience in SMA is rare. Even in children, it's relatively rare, so that you probably, again, are better off asking at your neuromuscular service if they know physiotherapists who have contacts with physios in private practice.
Okay, and what we will do is after this live, I will post the links to both of what Marion just said, so then everyone can take a look.
Lovely, thank you, Arnie. That's really helpful.
Another one is, when thinking of hand cycles, what would you recommend?
The hand cycles or foot cycles, there are two things you need to think about. The first with a hand cycle is making sure it's comfortable and it's easy to hold, because not everybody can grip, and also that you can keep your hands on, because if you've got contractures, you need to be able to reach. With foot cycles, you need to be able to keep your feet on. But the most important thing about hand cycles and static bicycles or exercise bikes is that they have resistance and you can make it harder. Now, generally, and it's important to note that in SMA, you cannot damage muscle. Exercise does not damage muscle in SMA. So never think that you can over-exercise or do the wrong exercise. You will not damage your muscle, but you can fatigue. And if you haven't done exercise for a long time, you will find that even a small amount of exercise can leave you quite wiped out. And the danger of overdoing it is You really overdo it, then you will find yourself fatigued for 24 or even 48 hours in some cases. That's more likely to happen in the more functional people with SMA, some of the 3s, the stronger 2s, but you can fatigue your muscles and basically fatigue them for a little while. And that's by doing too much. So we start off low weight, low repetition. So what we are talking about is, if you want to use resistance, you can start with something simple like the weight of your body. That is resistance to exercise. If I'm lifting my arm up and I do 100 arm lifts, believe me, I will ache. I don't have to put a weight in it to make it ache. So just lifting the weight of my arm against the resistance of gravity may be even more than I can manage. For a lot of people, particularly with contractures, limited range of movement, it may be that even working with gravity, so that gravity is not affecting you, just sliding in and out might be hard work. So you start with the number of times you do it and the amount of resistance, and you can increase in increments. You can keep a record of it. If you really want to do it in a very formalized way, you can write down how many repetitions and what resistance, and build and build and build on that. Now there is, and this is important, there is a maximum level that you can achieve in SMA because of the fact that you have a limited nerve supply to the muscle. There is a limited amount of power that muscle can generate. There will be a point at which you can no longer get past. And therefore, at that point in time, you cannot increase resistance, but you can increase repetitions. So you may find that if you add 200 grams, 300 grams, it gets too hard, then just go to where you were and increase the number of times you do it. There is within exercise physiology a thing called the repetition maximum. And the 1 repetition maximum is the maximum resistance, the number of kilos you could only do ever once. So if you think of the weightlifters who've got to their very maximum gold medal stuff, they're pushing and pushing themselves, but they could only ever do that weight once. That is their 1 RM, their 1 repetition maximum. And we work on power with a 10 RM, the weight that you can just manage 10 times before you have to give up. And we often talk about the 10 RM, the 10 repetition maximum. That weight is the weight that you are aiming to achieve. You don't want to get as far as the 1 RM. It's really, firstly, it's not madly functional. You're not going in for Olympic exercise. The other thing is, unless you are, and of course that's possible, but then you will have a trainer. But generally, if you're really keen to build up and build up, you are looking for your 10 RM. But better that you build up the number than you build up to that 10 RM, because ultimately it's about stamina, being able to keep going, being able to actually work past the level where you're going to get fatigue and repeat. Very rarely do we ever work against a high amount of weight. So the biggest weight that you're going to come across in daily life is your own body weight. Transfers, shifting, standing, moving. So your body weight is the weight you have to move. And that may be way past your 10 RM. If you can't lift your own bottom up, if you can't push your arms down and lift your own bottom up, then that's way past your own 10 RM. So you have to think that every muscle will have a different 10 RM. So while you may be able to do 300 grams of straightening your arm, it may be that you can do 400 grams of straightening your leg, or 500 grams of lifting your arm out to the side, and you may be different on both sides. Your ideal is to try and stay symmetrical, so that what you're doing on one side, you're doing on the other. Because if you constantly increase your stronger side, you will become more and more asymmetrical. So don't push to the point where one side is getting much, much stronger than the other, because that's not helpful either, because building up more asymmetries can affect the way you sit, can affect the way you lie, can affect your weight bearing, and can affect your posture. So you need to try and work symmetrically.
Okay.
Did that answer the question? I've got a bit lost now.
Yeah, I think it did. I think I actually answered 2 questions in one, because someone else asked whether when they're using the cycle, are they best to do short fast bursts or long times at slower pace?
A bit of both. Vary it. So sharp and fast. But again, think about fast against higher resistance and fast against a slower resistance is not the same thing. So again, speed is only an extra dimension. So you've got number of repetitions, the amount of resistance, and then speed is your third dimension. And speed only really helps if you need speed in what you're doing. So is there any benefit in going fast, or would you be better off actually adding a little bit more resistance? Speed is not something we actually do a lot of in neuromuscular exercise. We're not looking for speed. It's a nice little adjunct. It's very typical in running to do a short burst of fast and then a longer burst of slower. Fast and slow, but generally it's not usually what we do in neuromuscular exercise. You can add it for variety. It certainly will not be negative, but it won't add an awful lot to your increasing number of repetitions or your increasing resistance.
Okay. We've got another question, which my arm strength and typing ability is going rapidly after no decline for a while. What can I do? Okay, now it's very interesting that many times when I've spoken to adults, they find their arm function deteriorating. This very often happens in their 30s and 40s, and nobody seems to know why. It's not been investigated why adults suddenly start losing arm function. And I don't think anybody's looked at it because it's not an exercise issue. A lot of people will say to me, well, I wasn't doing any exercise before, so it makes no difference. And it's classic that you say with typing that your arms are getting really, because it's often that people will suddenly notice an activity getting harder and harder. And to be honest, I'm not 100% sure that exercise will help, because there are plenty of people who exercise and still seem to get this loss of function. I honestly do believe that the nusinersen and other treatments will reduce this loss of function, because one of the things that we've said all the way along, and we've tried to persuade NICE, is that you may not see improvement, but you may see that these people no longer deteriorate, the children no longer deteriorate. And NICE still don't understand this concept for some reason. These are supposedly some of the top people in the country, and they don't understand the difference between no improvement and no deterioration as both being positive results. So that we may not be able to work this. What you may need to do is look at your overall function. Now, very often, one of the things that happens when one function deteriorates is you try and compensate with others, so that when you're having difficulty with your arms, your shoulders hunch up, your neck gets tight, you get a lot of neck aches and headaches, and your posture sort of falls apart. If you are losing arm function, as I say, I'm not 100% sure that exercise can help. If you are not on nusinersen, speak to your consultant about salbutamol if you haven't tried it, because a lot of people will say it gives them more energy and stamina. I know a lot of people will say it has negative side effects. It makes the tremor worse, or it can give them palpitations. But the beauty of salbutamol is you can try it and stop it if you don't like it. It's not like steroids, and it doesn't have a build-up effect that it gets better and better.
You may notice that if you get increasing tremor, if you persist with salbutamol, it will go after about 3 months. So it may well be that salbutamol could be helpful if you're losing arm function. You need a physiotherapist or an OT to look at your working position. If it's a work issue and you go to work or you have an employer, then there should be somebody who can look at you. There is somebody, your ergonomic advisor at work should be able to look at your work position, maybe even look at your desk height, look at mobile arm supports to take some of the pressure off and reduce the level of fatigue. And what you may find is that if you've got a less fatiguing position, that you can keep going for longer. So it is about stamina. You can try and exercise. You can try and maintain the power. But people who constantly exercise will still say they are losing function in their arms. And I don't think anybody at this point in time has ever investigated that, because very few studies have ever happened in adults, which is very, very difficult. But as I say, it may be that exercise would help. It may be that you need an ergonomic assessment. It may be that salbutamol helps.
Okay, great. I will add as well with what Marion said about work and bringing an OT in. Universities will do that as well to make sure that you're in the best position if you're working a lot on computers. So if you're at uni and are struggling with that, get in touch with your disability advisor, because they will do that also. It's not just workplaces. We have had a few comments about a Medi motorbike and asking basically a bit about that and whether you'd recommend.
I have no idea what a Medi motorbike is. I'm not even sure how you spell it.
So it's MEDI.
And then motorbike.
Yeah.
Okay. I've got places where you sell them, but nobody's asking. No, all I've got is where you can buy them. Where do I get a motorbike license? I will look at that Medi motorbike and I will come back on that one.
Okay.
I've never heard of it, but I will come back on that one.
Okay. Once Marion has done this, we'll put a post up with what she says.
Yeah. Okay. Are we still there, or do we need to move on?
We have got a few more questions, but if you want...
let's go. If we need to, we'll just have to add this on to the next webinar. We haven't got a topic for that. It might be that we just have to keep going with the same things.
Yeah. Okay, so going back to what you said about taping, there's a question that says their dad knows quite a lot about taping due to working in the sporting field. However, when they've mentioned it in the past, they were worried it would hurt them because of it making the muscle work. Is that something that could happen?
Okay, I have been doing taping for a long time and I have never had taping hurt from making muscle work. If taping hurts, 9 times out of 10, it's on wrong. It's either too tight or it's in the wrong place. It should never, ever hurt. It either will work or it will not work. We have used it really successfully. I have, and I don't know, you may want to go and have a look at the taping webinar. A lot of adults we have successfully taped, not so much in the UK because I don't treat adults in the UK, but when I go abroad, when I go to Italy, Russia, Poland, we have done a lot of tape for hands. So what we find is that people cannot open their fingers. And taping really, really helps to switch on those hands. Now, we've done it with children, but I have also done it with adults, and we've had amazing results from taping hands. We have taped knees to switch quadriceps muscle on. Now, your quadriceps muscle, as I've got Ike here, is the one that comes down the front of your knee, and it's the kicking movement, the lifting your foot up movement. We have managed to successfully switch on quadriceps muscles in children, older children, generally teenagers, We have switched on those muscles, but there have been situations where we haven't. But it really, if it's done properly, we can suddenly get a contraction that wasn't there before. We switched on feet, we switched on dorsiflexors, that's the ones that pull your foot up. And as I say, very, very successfully switched on fingers and hands with tape. Tape should never hurt. It might irritate for 3 reasons. It's on too tight, it's in the wrong place, or you're allergic to the tape. But tape should never hurt. Now, I have actually been taped myself when I was doing a course and did find that it hurt. It was carpal tunnel syndrome taping. We were practicing on each other and the girl had done it too tight and it really began to get uncomfortable after a few minutes. But then that shows that taping that is too tight can often hurt. And the other thing about taping that is too tight, it can cause a lack of blood flow after the tape. So if you tape, I've had ankles that I've had to cut tape off when I've been working the marathon and I do the physio for the marathon. And I've had people who've been taped by professionals and taped so tightly that they've had swollen feet afterwards. So you do need to be quite careful when you're taping. Now, it's really interesting that you said that the father was in the sports field. And sports taping is very, very different from therapeutic taping. Sports taping is taping that you put on an athlete to allow them to go out onto the field, the track or wherever and re-injure themselves. It's about holding things still. So it has to be relatively tight and it has to be a fairly tough tape. That is not the tape you should be having on you to stimulate muscle.
Okay, great. We've got another one that says, I have an electric standing machine. When upright, is there any exercises I can do with my legs or core muscles, or is just standing good exercise?
Standing is good exercise, but there's lots of things that you can do while you're up there. When we're looking at core, we'll go back to the Pilates idea of core exercises. If you have a fixed spine because you've had spinal surgery into your pelvis, the only real core muscles you'll be able to do are abdominals because they're free. Your back muscles are very small. You have a very, very big muscle at the back of your neck. Here, trapezius, you have muscles that come into this upper part of your spine around your shoulder blades. But your actual spine extensor muscles, the muscles that will bring you up, are very tiny. There are rows and rows of little muscles that attach between the vertebrae. The shoulder girdle has some very big, powerful muscles, particularly in men. But your actual spinal muscles are generally quite short, and therefore they can't actually work very well. But you can do, if you're not fused, do the Pilates thing of trying to flex each vertebra and come back up. One of the things that we try and do with the pelvis Pilates style, you have 2 bones in your bottom. Physiotherapists will call them ischial tuberosities. I call them bum bones for some reason, and it always sounds very Star Wars to me. Pilates teachers talk about Sith bones. Now, I don't know where that word comes from. As I said, it sounds very Star Wars-ish to me. But you have, and you should be able to feel them, and if you're uncomfortable, you'll feel them more, 2 bones in your bum. I know your bum is well padded, but there are 2 bones in there. And those bones are where your hamstrings attach. So if you can think, and I know, Marnie, this is one for you, because this will help with sciatica, what you are trying to do is bring those bum bones down towards your knees. So what you're trying to do is pull, imagine there's a string, your hamstrings as it happens, pulling those bum bones down towards your knees, and that is part of your core working. So if you can do that, that will help you with your pelvic tilt. You always think of your pelvic tilt as coming from your tummy, but if you can imagine those bottom bum bones trying to pull backwards and down towards the back of your knees, you can do core muscles that way as well. So core muscles is about tightening your tummy muscles. There's 4 levels of muscle that we're talking about. We're talking about your upper abs, which are literally under your ribs, under your boobs, ladies, if you want to put it there, but it's under your ribs. There's your long and oblique, so you have long tummy muscles, and your oblique tummy muscles, your cross, the ones that twist you in the middle. And then right at the bottom, you have your lower abs. And ladies, if you're like me and had cesarean sections, forget it. It really takes some work to switch them on. And then you have a 4th layer of muscle. And those are the ones that are up inside. And we will talk about your pelvic muscles, and men, you have them as well. And actually in male incontinence, those pelvic muscles are equally important as they are in women. If you have a hernia, they're important. You need to learn to find your pelvic muscles, because they won't be affected by spinal surgery. So don't say, oh, I've had my spine done, I can't do it. Everybody, it's easier for women to find your pelvic muscles because you're just told, think about sucking up inside, but men, you can do the same. Your back passage and underneath, suck it up. That is part of your core, part of your abdominals. The beauty of that muscle is you can sit and exercise it all day and nobody knows you're doing it. So it's a wonderful exercise you can be doing when you're standing. And when you're standing, one of the beauties of doing it when you're standing is it's a totally different feeling for when you're sitting down and everything's scrunched up. You really get a much better idea of sucking everything up, trying to lift everything up, bring those shoulders up, work those shoulders and that. Really try. And the other nice thing about standing is it gives you a bit of freedom of movement around the shoulders, because very often if you're in a wheelchair, very hard to get away from the back of the wheelchair, whereas if you're standing in a frame with no back, it gives you a lot of opportunity to open those shoulders. Now, don't forget your breathing exercises. Lots and lots of work on breathing, and it may not work, but give it a go. You're trying to think about breathing not only into your lungs here, you have little lungs at the sides, lungs at the back, but actually think, I'm trying to get that breath in all the way down to my toes, all the way down to my fingertips. As you're breathing in, it's lifting everything. It's helping to lift that chest. Push the air down into your fingers, push the air down into your feet. Try and think of spreading that air around your body to really try and get a good breath in. And then just relax it out. Don't force it out, relax it out. Now, another important thing is abdominal exercise with breathing, not instead of breathing. A lot of people, when you say to them, pull your tummy muscles in, will hold their breath. It's a case of that is not how you switch your abs on. You should be able to switch your abs on. I'm sitting here switching my abs on and still talking and still breathing in and out. And that is your goal if you are doing abdominal exercises, that you can switch those muscles on and still be breathing. Okay, lots of things you can do in standing.
So this kind of linked to the next question is someone else has asked about breathing exercises.
Okay, so we've talked a little bit about breathing exercises. There are other ways of doing breathing exercises. Now, when you breathe, there's a lot of things that you can do to breathe out. You can blow, you can get a straw, you can, the big problem we have now with silicone straws is they tend to be a very wide bore and they're quite difficult if you want to do things like play games where you're sucking things up like cotton wool balls or makeup pads or something and moving them around. But that is inspiration. But blowing is very easy through a silicone straw because it has a wide bore, and you can blow football again with a cotton wool ball or a marble. You can do breathing exercises that way. So remember, when you're doing breathing exercises, you don't need to be able to breathe out. You need to be able to cough, but you don't need to breathe out. Breathing out is just relaxation of your chest. When you breathe in, you automatically breathe out. It's just relaxation. But to cough, you need to be able to force the air out. So this is why we do expiration, breathing out exercises, which includes blowing bubbles, blowing musical instruments, blowing into, so you can get a Coke bottle, the bigger, the harder it would be, but you'd have to get a long straw, and you fill it partly with water. So if you get a Coke bottle, fill it half with water, put it up in some washing up liquid, seal the top, stick a straw in, and blow into the water until it all fills up with bubbles. Don't suck the bubbles, tastes disgusting. But this is what, that's another nice expiratory breathing exercise.
Okay.
Okay, I'm join meeting here, let's have a look. It's just asked me to join the meeting, I didn't join before.
Oh.
Why that?
Technology.
So don't forget, there's breathing in and there's breathing out. So sucking, so get a straw, probably a paper one. As I say, the silicone ones have quite a wide bore, quite difficult, and play games where you have to pick things up with a straw and move them around is a good breathing in exercise. It's much harder to find exercises where you're breathing in. The only other thing I can think of is a mouth organ or harmonica, because you do actually breathe in for that. Most blowing instruments you're blowing out. Try blowing up some balloons if you're a little bit stronger. You probably won't manage it, but there's nothing to stop you trying. If you can't manage a balloon, get one of those inflatable balls. They're a little bit easier. Blow up some arm wings, some swim wings. There's all sorts of things that you can be trying to blow up, and particularly the ones where you grip with your teeth and then blow, because they're easier still. But there are plenty of breathing exercises, and if you can't think of any other breathing exercise, karaoke. Sing. One of the best breathing exercises you can do. And actually, seriously, if you sing, good volume, really try and be as powerful as possible for half an hour a day, you will increase your respiratory volume. Now, the other exercise that of course is brilliant for breathing is swimming, but at the moment, unless you've got a hot tub and you can sit at the bottom of the hot tub for long periods, then swimming's not really an option for a lot of people. But singing as loud as you can, belting out half an hour's worth of songs. You may annoy the neighbours, but you will improve your breathing.
Okay, great. We've had this question from quite a few people. Well, not the exact question, but questions of this type is, would you do a routine for people of different strengths for us to follow, especially for those who are going without physio?
Yes, we could do that. Now, one of the things that we've talked about with Treat SMA is a video of stretches. If people want, we could do some videos of exercises based on different ability levels. We did look at one of the webinars, does have some work when we were looking at the sort of things you can do in sitting and lying. Some people need them more individual, but we could certainly do some programs based on different levels of ability for arms, core and legs. That wouldn't be a problem. At work, we keep vast numbers of exercises. Interestingly, I had a young lady of 17, so almost an adult, came to see me a few months ago. In theory, she should have transitioned to adults, but she wants one more appointment at Great Ormond Street. Her brother's still there. And she was determined to keep up her arm strength. So I did an extensive program, including TheraBand. And Mum said, yes, she got it. She loved it. She hasn't done it at all. So we can give you as much as you like. But if you don't do it, it don't build up any power at all. So you've got to think about doing it. Two things. How often you do it. And secondly, do you need help to do it? Now, many adults, if you have a partner who is prepared to help you, fine. but your carers will have to agree, and not all carers will agree to doing physio. So that's something we have to think about, is making this something that wouldn't be difficult for the carers to help you with, because not all carers want to do this. So again, we have to think about who's going to help you to do it, or can we make it in such a way that makes it easy for you to do it yourself? Which is why, for those of you with weak arms, what I really love is the idea of doing lots of sliding exercises that you can probably do yourself on a shiny surface. Now, a shiny surface can literally be a big piece of cardboard from an art shop, and you can do it, you can put it at an angle and slide upwards, and there's a lot of things you can do with a piece of card, some weights, some gloves, all sorts of things. And again, it's a bit of using your imagination. This is real Blue Peter generation stuff. Just let your imagination run riot. Get some gloves, get somebody to sew weights onto a pair of gloves. You can get several pairs of gloves. Primark sell them 2 for £1, so it's not going to break the bank. Get the gloves, stick some weights on. It can be bells, it could be anything. It could be chocolates sewn on. It could be like you end up like a Christmas tree, that you get a reward when you've done a certain amount of exercise. But think what you want to achieve. Now, I think if we're going to do exercise programs, which yes, we can do, we have to think also about how often you're going to do it. Because one of the things about exercise is that it's all very well starting off really, really motivated, but you know there are people out there that are obsessive about exercise. You know, when gym became the big thing, you'd get people running every day, you get people who go to the gym 4, 5, 6 times a week. Why do they do it? Do they fancy the instructor? No, it's actually a drug. Exercise is a drug. The endorphins that it releases can become quite addictive, actually can become quite addictive. This is a high. This is a natural high. And I have to be honest and say it is rare to get to that level when you are in a wheelchair, and that is difficult. But we need to exercise. If you get really motivated and you do it for 3 or 4 weeks and then it starts to slide, in another 3 or 4 weeks, you've lost any benefit that you've had. You have to think that this has to be something that you continue with, that you fit into a daily routine, that is fun, that is something that you want to do, that is motivational, that it's not a chore, it's not boring, it's not that this carer will do it and that one won't, or my partner can't because they've got a bad back. Now that's perfectly acceptable and that's not a problem, but the issue is we have to think about these things. So up to a point, we can make exercise programs. On the other hand, they do up to a point also need to be individually tailored. Now, if you need to individually tailor your exercise, you have to think how you can do that, because it only takes a bit of imagination. And don't tell me people don't have it, because nobody has more imagination than people with SMA. You may not have the legs, but you've certainly got the imagination and the ability to see things in a way that other people don't. So you need to be involved in your exercise programs as well. You need to think about what works for you on 2 levels, both giving you the amount of aerobic exercise you need and also stimulating you, keeping you interested, keeping you positive, even when you can't see results. Because one of the biggest downers to any activity is not seeing results. Nobody is promising results. You are not suddenly going to get fitter. You are not suddenly going to be standing by yourself. You are not suddenly going to be doing things you weren't doing. It takes persistence. It takes acceptance that it might be slow. It may be that you are not making big progress in terms of improvement, but you are not sliding backwards like some people start to do in their 30s and 40s. So it's very much a case of being involved in your own exercise program, getting the most from it, making it work for you. We can only do that if we tailor them individually. We cannot make a one size fits all. There is no such thing as one size fits all. For our kids, each child gets individual that works for them. Now that's a lot of work. We can't do that. We cannot make a program for each and every one of you. So you have to think how you can modify those programs to work for you.
Okay, that's great. We have had another question in regards to exercise bands and what exercises you can do with them. Don't know whether you want to tie that in with doing the exercise plans or whether you want to answer that now.
We did a whole webinar on therapy bands, I thought. Did we not do a webinar? We certainly did quite a lot on bands. I think there is so much you can do with bands, much more than you ever think. But you have to think about, there are people who find them difficult to hold, so you have to think about how you can modify them. I don't have my box of bands with me. I have a big box of tricks, but I've taken it out of the room, I'm afraid. There are people who can't hold them very well. We have to make loops. You have to think about how mobile you are, because if you can't lift your arms, you can use the bands to take the weight of your arms, and that is so important. So many of you could do much more if you could just get somebody to take the weight of your arms, take the weight of your legs. Don't forget your legs. Just because you're sitting in a wheelchair does not mean you shouldn't be exercising your legs and your trunk and your core. It really is great for your circulation. Help those bright purple feet, stop some of that pain, stop some of those great puffy feet. There's a lot of positives about doing some exercise for your legs too. But even if you can't lift your arms and legs, the bands can take the weight and then you can do other exercise. But you have got to know what muscle groups you're after, because if you constantly just pull here like this, then you're just going to make your tightness worse, because the muscle at the front will constantly be stronger than the muscle at the back. So there's nothing to stop your contractures getting worse just because you stopped growing. What we're saying is they won't get better or won't get completely better because they are contracted from growth. Now, those of you who are very contracted, maybe you didn't have much stretching, maybe you didn't allow your parents or your therapists to stretch you. That's perfectly possible. Okay, let's forget that. But what we have to say is they can still get worse. We have to think about it. We have to think about the range that's available. If you're very contracted, if you can't turn your hand at all, there's no point in doing lots and lots of exercise to try and turn your hand. We can do the static exercise. That's important. But then the band is not going to do static exercise. The band is all about movement. So when we're talking about bands, we've moved away from a lot of static. Now, there is some static work you can do in this midline position. You can pull, get nowhere, but keep pulling. But to turn may be more difficult. But the bigger movements, you've got to be able to actually get your arms and legs into the position. The beauty of TheraBand is you can tie it onto your wheelchair, you can tie it over your bed, you can tie it onto the hoist bar. That's a beautiful place to be doing exercises with the TheraBand tied onto the bar, hanging down, and grab it and pull. Think of yourself as a bell ringer. There are loads of things you can do with bands. The only one I would be very, very careful of is anything to do with the head. Firstly, if you want to use the TheraBand as a sling, you really do need a very wide TheraBand, one of the stronger TheraBands. So we're talking about the blues, the dark greens, the blacks or grey, because they're wider and because they don't stretch as much. The thinner ones will go into a thin line and just knock themselves into your hair. The other thing you've got to be very careful about is that you don't get smacked in the face with the band if you get recoil. So you have to think about being careful around your face and head. But apart from that, there is loads of exercise you can do with bands. Now, there are several websites you can go on to. If you just Google TheraBand exercise or therapy band exercises, there is tons of stuff. Now, TheraBand is a make, and they have their whole exercise book on the internet, absolutely free. You can go in there and have a look at their exercises. They are all on there.
Okay, great. This one actually links to what you just said about using a hoist. is saying, I attach my arms to a hoist for exercise, but I worry that I could overwork my muscles through micro tears. Could you give some advice on this?
There are no micro tears in SMA. Micro tears are very, very difficult to do. You would have to really be working hard to get micro tears, and you are talking about real athlete level to get micro tears. It's like micro fractures you can get, particularly around the knees if you know you are osteoporotic. But micro tears are really not a common thing at all, and they're really only top athlete level stuff. So I don't know where you think you've got the idea of micro tears from, but never in 30 years of doing neuromuscular have I ever come across somebody with SMA having micro tears. Now, what you get in dystrophy conditions, and that means that you have to have the word dystrophy after your diagnosis, what you get is you get the muscle fibers break, and then they are replaced with fat and fibrous tissues. Now, these are not micro tears of muscle. This is dystrophic muscle. This is muscle that cannot mend itself. If somehow, some way I tore a muscle, and it would take an amazing effort. You know, you do not tear muscle easily. It's not that fragile, even in SMA. If I tore a muscle, then yes, I am going to get some level of loss of stretch, because when it mends, and it does mend, then there is going to be a lot of fibrous tissue holding it back together. So instead of mending with lots of nice stretchy muscle tissue, it will mend with a certain amount of fibrous tissue, and then you actually have to stretch that to get your muscle effective again. But actually, micro tears are not going to happen in SMA. You do not have that fragility of the muscle fibers, and this is not micro tears. This is actually fiber breakage in the dystrophies. Now, there are many different types of dystrophy. There are so many limb girdle dystrophies that they were numbering them 1A to Z, and they ran out of numbers. So they've totally reclassified all the limb girdle dystrophies, because they got to 26, they got to 2Z, and then they had nowhere to go. People thought that they might try 2AA and 2AB and go on like that, but they've actually totally reclassified all the limb girdle dystrophies because they ran out of letters. But each one is a little bit different. Some are more fragile than others. Duchenne muscular dystrophy, some of you may know people with Duchenne muscular dystrophy, is one of the most fragile. And that is one of the easiest to break. But this does not happen in SMA. So please do not think you are going to get micro tears in your muscle. But going back again, you can get micro fractures. Now, we would have talked about that with stretching, but we're going to run out of time. So I would say, Marnie, perhaps in 2 weeks, we should come back and talk about adult stretches, because I think we've probably still got enough questions on exercise to finish this session.
Yep, we can do a part 3.
Yeah.
Part 1 last week.
Okay, any more questions on exercise?
We haven't had any more questions. However, we have had someone comment in regards to the Medimotor bike. It's actually called a Medimotion bike. Medimotion bike.
And I think it's literally just a set of pedals.
I'm not sure.
I'm sure, because I was looking it up for somebody only this week. We were talking about that, and if you're wondering what I'm up to, I'm on my iPad, and I've got Medimotion bike. There we go. Medimotion. Yeah. It's quite a bulky piece of equipment. I have seen them before. You very often see them at the therapy exhibitions like NADEX. They're really quite a bulky piece of equipment. There are ones that are much, much smaller that go round and round. This to me is more the sort of piece of equipment that a therapy gym would have, or even a gym. It also looks incredibly expensive. And there are much smaller things than this. There are much, much smaller things than this. The only thing is you can get certain ones that do have feedback that, I don't know how many of you have seen that now you can get running machines and things where you can be running through the streets of Paris, you can be running through mountains, and you can do different runs. And then you can get the same things on these bike machines where you're cycling through the middle of Rome or whatever. So there are some nice ideas that go with them, but that actually looks really quite expensive. And there are much, much cheaper ones. You go onto Amazon and you literally have a set of pedals that you can increase the resistance, and you can be on that arms or legs. And that to me seems a more sensible option than this thing that looks incredibly expensive, particularly if it's a one-hit wonder and you use it for a little while and then give up. But it looks to me much more the sort of thing that a therapy gym would have than an individual. It's quite a bulky piece of equipment by the looks of things. I have seen them before. And as I say, one of the nicer ones, and the ones on the website, there is one where somebody's sitting in front of the television doing it. But there are actually other versions of this where the program does have feedback, where you can see where you're cycling, where you can go up a hill and go up. And you have the programs where you're doing a little bit of flat, a little bit of downhill, a little bit of uphill. So there are quite a few different versions of that. But yes, I have seen those before. I wouldn't necessarily say they're the sort of things you're going to have at home. Okay, so how often are we exercising? In theory, we are supposed to do between 30 minutes and an hour of aerobic exercise every day. Now, aerobic exercise is the exercise that you get when your heart rate increases. And we're not talking about bursting out of your chest. When your respiratory rate increases and when you're a little bit warmer, not dripping sweat, not totally breathless, but you should be able to feel you've done some exercise. So those people who are walking, if you just go out for a walk at your normal pace, that is not exercise. Going out for a walk will give you fresh air, but if you don't increase your pace, if you don't push yourself up a hill or even down a hill, if you don't go a little bit faster, wear a pair of heavier boots, have some wrist weights on, you are not actually going to do an awful lot of exercise. Going out for a stroll is not exercise. Pushing a Hoover around might be exercise. But again, you have got to work. Now, there is another way of exercising that we haven't touched on when we go back to hoists, and that is the standing sling. And more people are getting standing slings for their hoists and working, doing it. Really is a nice position. I've got a brother and a sister who've got a standing sling. They're busy fighting over it because they're playing football in it. So actually they want two standing slings so that they can both play together, which is difficult when they've got different bedrooms. But it's actually quite a nice place to be in a standing sling, because you can do a lot of leg work that you can't do when you're sitting down, and leg work that you can't do in a standing frame. So actually another place to exercise is a standing sling, and it may be worth speaking to your OT about getting a standing sling to allow you to do some exercise in standing. That's quite another nice way of actually getting some exercise. And for somebody who finds a standing frame very uncomfortable because you're too contracted, or, you know, we have several people who've got hip pain, or who find that their feet, they get pins and needles or whatever when they're standing in a standing frame because of the restriction that it imposes, may well find that standing in a standing sling, as long as it's comfortable. Now, it's not that easy to find one that's comfortable. You may need to make sure that your OT just doesn't dump you with something and say, there you are, that's what we give out, because we've had that situation as well where the OTs or these services have been a little bit inflexible and they have one bog standard thing they give to everybody, and one size again does not fit all. One of the problems in children, and it's, I think, personally think it's possibly even worse in adults, is that we're not all the same. We're not all the same size. We don't all have the same contractures. Some have scoliosis, some don't. The majority of you type 2s will have had spinal surgery. You know, one size does not fit all. And I think it's got to the point in terms of equipment where you are expected to fit the equipment rather than the equipment fitting you. And that's a real negative. And I think you really do need to be a little bit pushy with your providers and say, that doesn't fit me, that doesn't work for me, I want something different. There is other stuff out there. You can't just dump stuff on me because that's what you have in stock or because that's your preferred supplier. I think people have got to be a little bit assertive when it comes to equipment, of not accepting the one size fits all approach of some areas. Now that's easy to say because we're working to budgets and whatever, but if they're going to give you £300 worth of equipment that's going to sit there and do nothing, then they've wasted £300. If they're going to give you a £380 piece of equipment, which is £80 more but gets used all the time, it's a much better value for them than wasting £300 that's not going to get used. So you've got to look at it in their terms and say, look, better that you give me something I'm going to use, even if it's a bit more expensive, than something that's never going to get used. So we need to think about how often we're exercising. It should be every day, not to the same level, not necessarily to the same level, but you should be doing something every day. And if you really are having physio or a private physio, or you know, make Sunday evening or whatever day, Saturday morning, your exercise morning, remember, you've got to do it consistently, because if you do it for 6 weeks and then stop, all the effects are gone in 6 weeks. If you know you've got nusinersen injections starting, do put that bit of effort in between now and then, because it will help at the other end. This is what we call prehabilitation. The better you go into a treatment, the better you will come out of a treatment. If you've got to have surgery, if you go in healthier, you will come out healthier. It's as simple as that. Prehabilitation. Pre-nusinersen is the same thing. Some of you may be going on to other drugs. It's not different. The better you are, the stronger you are, the more used you are to exercise, the more you will get out of that treatment. Exercise should never hurt. If you have pain and you are trying to get rid of pain, you need to think about the movements that you can do, the movements that you're doing. If you have specific joint pain, then you need to think about, is that because the joint is stiff, or is it that the joint hurts when it's moved? Because then exercise has different effects. Then we have to think about exercise differently for the joint that hurts when it doesn't move and the joint that hurts when it does move. Again, we have to think about nerve pain and nerve impingement and what exercise does for that. And we have to be very careful if you have nerve impingement like sciatica or neck or other leg pain. You can have femoral nerve impingement, which is when the pain goes down the front. And then we have to think about exercise that will take that impingement away. We can do traction. We can do other things that help. Neck pain. We forget that a lot of neck pain is from a lot of having those shoulders up around your ears. And again, we need to think about long necks. We need to think about exercising that head. Too often people forget their head. They talk about their arms, their legs, their core, forget their head and neck. Now, everyone out there can do head and neck exercise, and one of the best ones you can do is when you're lying down or in the headrest of your chair, is literally just push back as hard as you can, not move, just push, really push your head and shoulders backwards and slowly relax and push back. Lengthen that neck, see if you can get it away, get your ears away from your shoulders, push your shoulders down. You want your shoulder blades down towards your backside, stretch that neck, really can be incredibly good exercise for your head and shoulders, and you're not doing enormous movements, but it's a really, really important exercise to stretch and exercise that head and neck. You can lie on your side and push sideways into the pillow, or turn your head and push sideways. If you've got one of those headrests that comes around, push sideways into it. So don't forget that head and neck. Don't forget little things like your toes. We talk about the exercise you can do for your fingers, but why are you not moving those toes? Help with that circulation. Pump those calves and try and stop those feet swelling. Okay, any more questions, Marnie? Otherwise, we're almost finished.
Yeah, we've got a couple.
Okay.
So leading on from your answer about the micro tears, they have asked, does that suggest that there is no negative to exercise apart from maybe a slight contracture?
There is no negative to exercise if you're exercising the right muscle groups. We don't want to over-exercise the strong muscles, because if they're strong muscles, so we know which are the strong ones. This brachioradialis is strong, the ones that pull your arms down are strong, the ones that bend your knees are strong, the ones that bend your hips are strong. If we only work those muscles, we will get tighter and tighter, and it will get harder and harder. But yes, it's getting the right muscle groups, but you are not going to damage muscle by exercising an SMA.
Okay, and going to the standing sling, is there a weight limit, and can they be used with any hoist?
They certainly can be used with ceiling track. The standing slings may not be used with the mini hoists, but normally with a normal mobile hoist, it should be able to use the standing sling. The weight limit is the same limit for any sling, but again, you need to make sure you have your portable hoists will take a standing sling. Certainly a ceiling track hoist will definitely take a standing sling. You need to check with your manufacturer or with the information you've got about your portable hoist as to whether you can take a standing sling. In theory, if you think about it, your weight in standing is the same as your weight in sitting. So the possibility of your hoist tipping is really minimal, because if you weigh 80 kilos, you weigh 80 kilos whether you're sitting or standing. The problem often is the height. Can you get the height? Will the hoist go up high enough to allow you to stand, or does it not lift you far enough up? Is there anything restricting, ceiling or something where that hoist is? But in theory, no, there shouldn't be any reason. The beauty of doing it in a ceiling track is you can move around the room. But that's the advantage of ceiling track hoist over a portable hoist. But the mini portable hoist may not take a standing sling. Apart from anything, they may just not lift high enough.
Okay, and another one in regards to the standing sling. Do you need full neck control to be able to use them, or can you get them with head supports?
You should be able to get a standing sling with head support.
Okay. I think I'm getting questions sent through, so I think that's it in terms of questions, because it crashed on my phone.
Yeah, I must admit, we seem to have run out of time. We haven't even touched on pain or stretches, so that looks as though we've got another session in 2 weeks, Marnie.
Yeah, I think that's a great
idea. Lovely.
Yeah. Okay. Thank you very much.
Exercise programs.
Okay, great. And I'm going to message Marion after this about the links for the private physios, and then I'll get them posted up on our community pages.
Lovely. Thanks a million, Marnie. Good night, everyone. Take care. Bye.